Live from the Carl Chevrolet Studios in West Des Moines, this is Iowa Live.
Hey everybody, Brightside Aesthetics and Ducharme Dermatology excited to bring you M-Face, a painless anti-aging treatment, and Exion for non-invasive body contouring. And here's the kicker, you can try these new cutting-edge technologies for yourself happening on Thursday. Now, details are on your screen right there, but they are going to be on with us tomorrow. Dr. Aaron will be on with us tomorrow explaining all about this and how you can try this for yourself. Well, welcome back, everybody. This is Iowa Live, and I'm introducing to you Dr. Abbey Woodbeck from Kinetic Edge Physical Therapy. Great to see you.
Thanks for having me.
We need to find out all about you and what your specialty is at Kinetic Edge, because so many specialties are involved here. First of all, tell us a little bit about yourself.
Yeah. So my name's Abby. I just started earlier this summer at Kinetic Edge.
Okay.
I really see two specialties. I see pediatrics of any age, 18 and under. We can even get into the 19, 20 if you feel like you're still a kid at heart.
Okay.
And then I see some nerve work as well, particularly in the hands and elbows.
Okay, and why pediatrics? Why did you gravitate toward pediatrics?
Yeah, I just really felt like the foundation that you get when you're the 5, 6, 7, 8, really any age that really sets you up for success for the rest of your life, whether that be strength-wise, range of motion, or just your ability to do things. And I don't know, that really spoke to me. I gravitated towards it.
Now, when do parents bring their kids in for you to work?
Absolutely any age. I see as young as a few months old all the way up to, that 18, 19, 20.
And why would they bring kids to you?
Sure. So I have people come in saying, you know what, my toddler looks at me to my left, but I've never seen my toddler look to the right, or their head kind of tilts a certain way, or they don't like to grab their bottle with their right hand. That's for the really littles, but once they turn to be 1, 2, 3, I have a lot of people come in and say, it's weird, my first kid walked at 1, but my second kid is 16, 17 months and they haven't walked yet. So I see a lot of that as well.
And what are some of the causes of things like that? What could be the causes of things like that?
Yeah, sometimes it's just not exposure to the environment, so we work on just exposing them to different environments to get them walking, crawling, whatever it is. Sometimes it's abnormal muscle tone, so getting them stronger, or a lot of the times it's foot placement. So sometimes we'll have people say, their feet are kind of turned out, or their feet are kind of turned in, or they roll out. So we just kind of work on that strength through their ankle so that they can walk. All
right, and I think probably the best thing to do if somebody has questions about their children and about whether or not your physical therapy would be able to benefit them is to be checked out.
Absolutely.
Okay, and you have a great way for people to be evaluated. Talk a little bit about that.
Yes, we offer a free screen. It's totally free. It takes about 20 minutes. You just come into the clinic, obviously bring your child with you.
Okay.
We'll talk for a few minutes, talk about the milestones your kid has experienced or hasn't experienced, and we talk about if PT is the right fit for you.
What's the first milestone? There's the form that you could fill out on the screen there. What's the first milestone you think parents should look for?
Rolling is a really big one.
Rolling?
Yeah, so can your child roll from their back to their belly? Can they roll from their belly to the back? That's usually the first one that parents start to notice, they're not rolling over to grab a toy. They really stay right where I left them on the floor. So around 6, 7, 8 months, starting to look for that rolling aspect.
Okay, well, let's talk about another thing that you mentioned. You said tingling.
Yep.
And, as we're getting a little older, we notice the tingling going on in our fingers, maybe even your 2 little fingers.
Yep.
So is that common?
It's super common. So people, for whatever reason, whether they had an injury or they just woke up one day, will come in and say, I have tingliness in these fingers or all the way down my arm. So I see that part of the day as well. It usually is just releasing some tissues, getting some joints moving right, and let those nerves breathe.
How long is a typical treatment for something like that? Because there's a lot of people that mention the tingling going on, even up and down the side of your legs.
Totally.
That's another one too, right?
Totally.
Okay.
Treatments are 40 minutes long. I usually see people once or twice a week, and it really varies based off of the person, but some people see success pretty quickly in just letting those nerves breathe, and oh my gosh, once we get those muscles to relax, I'm not getting that tingliness when I'm texting or reading or anything like that.
See, that could be too. So now, where are you located? Tell me where you are.
Sure. So I'm at our Des Moines office, which is right over by Valley Junction on Grand Avenue. We've got a few different therapists there.
What, 6,000 grand?
6,000 grand, something like that. Sweet K, I think,
And the thing is, they look at all the different locations that have opened up. An Ames location just opened up another one, so you have a chance to go there. But this is where you need to go if you have any questions at all.
Absolutely.
Your website. Let's tell everybody about the website.
Yeah, so we've got a website online. That's where you're going to find the free screen form. And that's really where you can learn a little bit more about what therapists do we have at our location, because I'm just one of a few therapists and they see a wide variety of different things. So even if I can't personally help you, I'm sure someone can.
All right, ConnecticEdgePT.com. Thanks for watching, everybody. See you tomorrow.
Okay.